This meeting is being recorded.
Okay. Thank you so much for the opportunity for our team to do this presentation. Our topic is about economic growth. We are taking brief minutes to look at the proponent and critics of economic growth in the following slides. We are a team of 4, and then I will do the introduction and the proponent part. Then my colleagues will follow. Basically, the green in the society illustrated through the ups and the ups, based on the economic dynamics that exist. The balance, there is that submission that for the economy to be able to achieve, it has to have both the ups and the ups not. So in other words, you cannot have a society that is only one-sided. You have a society that is one-sided. There is a submission that will not be able to achieve a balanced society. We are going to look at the imbalance that exists between the healthcare, provision of other basic necessity services, and as proponents argue that an economy that is presented which does not portray the two elements in terms of the social outcomes, it is likely to not present that balance, as I have already mentioned. Now, to the proponent section, I'm going to rely on some two models. The first model is by Mikel and Dimed. They have given an illustration of poverty rate, the imbalances that exist in the society. And I have a line graph that demonstrates the poverty rate in the year 2020, and the figures. When you go through the line graph, you're able to see the imbalances that exist and how it makes it, how it promotes that coexistence in terms of the economic structure in the place that is providing the beneficiary between the two sets of the haves and the absolute. And then when we look at food insecurity, there is also data from the American Bureau of Statistics that was done by two researchers, that is Nestra, is providing and demonstrating how food policy and the problem they exhibit in terms of the haves and the haves not, and how that imbalance can be able to play in the society for the society to have the expected balance from the two groups. I had already mentioned about healthcare, so briefly, this is also a presentation about the sick sickness between the haves and those who don't have. What is the impact? How does the sick impact the economy between those ones who have and those ones who don't have, and what is the imbalance that we get from that in the aspects of economic greediness. I think that brings the end my slides. Then next is Victoria.
Okay. Move on to the slide. I will be investigating three main critic arguments today. The first being economic growth argument. Critics of the proponent's view argue that greed-led economic models incentivize innovation and therefore economic growth. It's suggesting is that when focused on inequality alone, the positive effects of economic expansion are overlooked. Data for this model is based on the figure you see here. The countries with the highest greed, or those in green, are also those with the highest income level based on World Bank data from 2023. And we can see here that that includes the United States. The second is going to be the individual responsibility argument. The premise of this argument poses that choices and behaviors play a significant role in economic outcome. Factors like education, work ethic, and personal responsibility outweigh systemic economic factors according to this theory. This perspective is incomplete, only placing emphasis on self-reliance. It downplays the role of structural inequalities, which do in fact perpetuate poverty and disadvantage. My third point is going to be the government intervention and efficiency argument. Critics may also argue that government interventions aimed at reducing inequality can be inefficient and or counterproductive. Government programs that have failed to reduce harm are usually pointed to. However, this argument neglects that government action does promote economic growth for the long term. The figure here shows that federal aid is targeted at basic needs, food, food and healthcare, showing that government aid is designed to assist during periods of survival, which will allow the individual to seek long-term economic growth.
Uh, Hold on. I think it's like Joshua. I think you have to mute yourself so Victoria can be heard properly.
Oh, could you mute your there? So what happens when the critics' arguments are played out in the real world? We could go to the next slide. Awesome. Greed-led economic models will attempt to control costs by placing barriers on government-funded welfare programs, leading to devastating impacts on those who struggle to meet their needs most. According to the Federal Reserve, they track that 34% of Americans already live paycheck to paycheck. The OECD stated that in America, a child brought up in poverty will need 5 generations to meet the mean income in their society. In total, critic arguments that support this model are incomplete. Next, I will be illustrating 2 examples where greed has perpetuated poverty in the United States. Awesome. Go to the first slide. Thank you. First, I'll be using the Rust Belt example. In the 1970s, deindustrialization set into the United States and declined manufacturing in the Rust Belt region. This led to companies pursuing greed-led economic decisions. For example, they ended up moving their production overseas, where labor costs were much cheaper. They did this to prioritize profits and shareholder value. But this action led to significant job losses, economic decline, and social disruption. The first figure you see here is just to show you where the Rust Belt is in the United States. It goes from about Lake Michigan to the middle of New York State and the area surrounding. And the second figure, which is on the next slide, is a figure from the Bureau of Labor Statistics in 2025, showing that unemployment rates are highest in the Rust Belt region still, showing that over 50 years later, greed pursued by companies in the 70s has still had long-term effects on these communities. Next, I'll be discussing the opioid crisis. As reported by the CDC, the opioid crisis lasted between 1999 and 2019. Within this period, 500,000 people died from overdose involving prescription and illicit opioids. This occurred because pharmaceutical companies marketed opioid painkillers even while knowing their high risk of addiction. The figure on the next slide shows the deaths per 100,000 persons in each city. Interestingly, there is a cluster representing high death count in areas in and around the Rust Belt, showing that these communities are and were incredibly vulnerable. So, as I close, I want to question the evidence that I provided here today. If we go to the next, thank you. While there is real data showing high unemployment rates in the Rust Belt, it would be biased to contribute 100% of it to greedy manufacturing companies trying to cut costs. Secondly, pharmaceutical companies have shareholders to impress, and drugs are expensive to produce. Further, the individual's physician is responsible for their prescriptions, meaning that while pharmaceutical companies are producing the drugs, they are not responsible for administering them to the individual. Patients are required to consult with their doctor first and use as advised. And to conclude, while we acknowledge that this data has nuanced perspective, it also illustrates the serious potential for harm when greed-led economic models are adopted. Next is Andy presenting as the skeptic.
Thank you, Victoria. Hi, my name's Andres, and I will be the skeptic. And in my points of view, in my points, I will discuss about correlation, barriers, data limitations, and how a complex topic cannot be piece by piece without further detailed researching. So there's a difference between correlation, which has something to do, which is a relation or association with two factors or things, and causation, which is if a change occurs to one variable, another variable changes. Now, the the correlation of greed-driven economic models to and negative outcomes doesn't necessarily mean there's a cause that it happened in the first place that it leads to poverty increases. Now, greed hasn't been around for before capitalist models, but so has poverty and inequality existed before then. What we know as models today with capitalism in the US specifically. There's other factors that contribute to this, such as culture, geographically, education systems, healthcare, and government quality that can lead to poor healthcare or food insecurity or lower income, uneducated individuals. Now, personal responsibility versus structure barriers. Now, there are outcomes that are not solely result because of economic greed within businesses, as it could also reflect through the choices, through the education, through the health of the individual and their work ethic. An example of this can be that two kids from the same neighborhood can go to the same school with the same resources, the same education, same lunch, same everything. As one kid can study really hard, go to school every day, apply for scholarships in college, go to school, study really hard, and get a job as a lawyer, a doctor, or something productive, very productive. However, where one kid does not go to school daily, does not do the schoolwork, not good grades, and stay within the poor neighborhood or rural area. A counter to this that personnel responsibility is ignores the other systemic issues such as healthcare denied, underfunded education, and job discrimination within lower income areas. To add on from the example is that the kid who studied really hard had both parents, had teachers to encourage them to try on really hard and are surrounded with good people that want to be successful. However, with the other kid was surrounded with a poor condition, such as a single parent household, have no teachers to be really supportive, surrounded with uneducated and mischievous students as well, or also receive racial treatment, racial discrimination from the school, the police, authorities, or other kids. Now, there are limited data regarding about how economic greed and methods hurt the lower class, as Not all data is perfect. It can be either false, misleading, or incomplete about any small factors such as neighborhoods, the police brutality, family household conditions, health problems, income, finances, being untruthful, as there are other factors that also contribute to this as data being limited, such as natural disaster, family loss, outbreaks such as pandemics, violence or wars in neighborhoods, and also government choices, not specifically from businesses. It is really complicated to dissect piece by piece of a very detailed situation, as there could be many things that could affect this. Not only that, if businesses earn money by producing products and giving by and also improving their products, medicine, foods, devices, technology, and for society. If businesses stop making money, they'll stop growing the business. It can hurt the workers, production, and management. And as I end off, I will give the stage to the summarizer.
All right, perfect. This presentation has explored the complex relationship between a greed-driven economic model and their impact on disadvantaged populations. While proponents argue that these models drive economic growth, critics contend that they exacerbate inequalities and lead to negative social outcomes. The evidence presented suggests that unchecked pursuit of profit can have detrimental consequences, particularly for vulnerable communities. However, it is also important to acknowledge the potential benefits of a market-oriented economy and the limitations of government intervention. A balanced approach is needed, one that promotes economic growth while also addressing issues of inequality and social justice. A call to action. Further research is needed to fully understand the complex interplay between economic systems and social outcomes. It is crucial to develop policies that promote both economic prosperity and social equity. This requires a commitment to evidence-based policymaking, stakeholder engagement, and a willingness to challenge conventional wisdom. By working together, we can create a more just and sustainable economic system that benefits all members of society. Ultimately, this evidence is undeniable. A government fueled by economic greed perpetuates inequality, neglects public welfare, and transforms human lives into economic variables. The economically disadvantaged, those who lack access to stable employment, housing, and healthcare, suffer the most, particularly those who are caught in a system that exploits their labor while denying their humanity. Whether through underfunded public services, dangerous policies, or corporate profiteering, the consequences are deadly. To change course, the United States must confront the role of greed in its policymaking. Economic issues should not come at the cost of basic human rights. Reform must prioritize transparency, ethical governance, and investment in communities over corporate interests. Only then can the U.S. live up to its promise as a nation of opportunity, not just for the privileged few, but for all who seek refuge, dignity, and life. And then the following slide has our references or our works cited.